Welcome to the fourth module in the EVMS Connect4Health Wellness Coach Training Series. In this module, you will learn communication techniques that will be helpful when interacting with your participants. Communication is an essential part of any relationship. Good communication will lay a strong foundation to help your participants succeed in setting and achieving their specific health goals. To help your participants stay motivated to make healthy changes, we recommend employing motivational interviewing, a communication technique that is commonly used to help people manage addiction and to lead a healthy lifestyle. Motivational interviewing works by helping individuals become motivated to change their behaviors and to commit to a goal. The core skills of motivational interviewing can be remembered by the abbreviation OARS, which stands for open-ended questions, affirmations, reflections, and summaries. When discussing a personal goal or behavior change, it is best to have the participant do the majority of the talking. You can drum up conversation this way by asking open-ended questions that encourage them to elaborate further. Good questions often start with what, when, how, or if statements. Allowing participants the opportunity to discuss their concerns or questions freely without being confined to a yes or no response lets them take control of the conversation and puts you, as the wellness coach, in a better position to give the best advice. Another motivational interviewing skill is using affirmations to highlight the strengths in your participant and to help build a rapport with them. In one scenario, let's say that a participant's goal for the week was to cut back their daily soda consumption from 5 cans to 3 cans a day. At the end of the week, they tell you that they're disappointed because they only decreased to 4 cans instead of the initial three as was planned. Instead of focusing on what they were not able to do, focus instead on what they did accomplish. Decreasing to 4 cans is still a major improvement. Offering periodic affirmations in this way can help your participants maintain motivation throughout the remainder of the program. The next motivational interviewing skill is reflections. And reflections are useful to help your participant and let them know that you are listening to them. Start with statements like it sounds like, or what I hear you saying is, or it seems as if, to display to your participant that you are actually listening to what they're saying and you're actively trying to understand their perspective. Reflections can also be used to highlight negative aspects of their current behavior and to get them, the participant, to come up with solutions and make a goal. For example, you could start with an open-ended question and ask, what about your current eating habits concern you or worry you? And your participant may respond with something like, I know that too much salt can make my blood pressure go up. With this information, you can then say, well, it sounds like you have some concerns that your current eating habits are negatively impacting your health. What do you think you can do about that? Now the participant is able to come up with their own plan that they will feel confident to stick to because they created it. If they're having trouble thinking of anything, you can provide some options for them taken from your goal menu, which is a useful tool that will be discussed at a later module and shared with you on RedCap after you have completed this training. The next motivational interviewing skill is summaries. Summaries are similar to reflections, but they're great to use at the end of a session or when you're moving on to another topic. You can use summaries to highlight the important elements of a discussion and also to express to your participant that you are paying close attention to what they have been saying. You could say, for example, something to the effect of, during this session, we talked about your concern with your current eating habits and made a plan to reduce your sodium intake by X, Y, and Z. One important communication pitfall to avoid is conversational narcissism, which is described as the tendency of a person to take over a conversation by focusing the conversation on themselves. Instead of supporting and acknowledging the other person's response, conversational narcissists shift the focus to themselves. In an exchange between a conversational narcissist wellness coach and their participant, the dialogue will flow something like this. The participant would express being busy and having a hard time to go grocery shopping or visiting the food pantry, and the wellness coach would express that they were also feeling busy and overwhelmed, but they were able to get their grocery shopping done. So why can't their participant? In this example, the coach used a shift statement instead of a support statement. In a more supportive exchange between a well trained, listening, supportive wellness coach and their participant, the wellness coach would ask the participant about their barriers and encourage them to think about ways to address the problem. And this is what we want you to do. So, your first contact with your participant will be a phone call to introduce yourself and to complete the participant assessment form, which goes over medical and social history, their perceptions of their weight and diet, and determines their activity level and lifestyle. Based on this information, you can help your participant come up with their first goal and a plan to reach it. Keeping detailed record of your encounters with your participant is really important. In the contact log, which we will share with you after you conclude this training, be sure to note the date, time, duration, and summary of the discussion. Before ending with your participant, be sure to schedule another time to talk with them, and we actually recommend getting on a regular routine schedule in which you can contact your participant. We will share all forms with you as surveys for you to complete in REDCap as soon as you conclude this training. This program lasts a total of 30 days, approximately 4 weeks. Each week, you're required to contact your participant at least 2 times through their preferred means of contact, be it phone call, text, or email. One of the contacts should be to assess the progress of their goal. If it's going well, you should advise them to keep with it. But if they are struggling, you may need to think about either modifying the goal or coming up with a new one altogether. The goal menu is a useful resource if you and your participant are having trouble coming up with goals. We will share the goal menu with you as well after you have completed this training. In addition to your weekly call, it may be beneficial to your client to communicate during the week as well. And so we expect you to communicate with your participant at least once a week to assess their goal. But the second communication should also be some sort of midweek contact as a way to support your participant in between goal assessments. And so this would be a great time to send an encouragement text or email to offer support to your participant, especially if they're struggling or they need some advice. Some examples of things that you can do are listed here on this slide. When talking with your participant and trying to help them set up their goal, you may meet some resistance to certain behaviors because of these common perceived barriers. What is important for you as a coach to be aware of is that there are ways to overcome these barriers that maybe you and your client has not thought of before. And so we want to be able to provide some solutions to commonly offered barriers. So some participants say they don't have time to grocery shop for healthy foods, and so a way to overcome it is maybe to bring a list to the store or to seek alternate ways to get groceries. If they are at food pantries that pack the bags for them, they can always use that as well. And also, some participants say they don't have time to cook healthy meals, and they can overcome this by cooking 1 or 2 healthy meals and packing that away or doubling the size of a recipe. There are many other solutions. So we just want to let you know that these are some barriers that may come up that participants may offer, but we have some common held ways to overcome it, and we encourage you to try using some of the what we have listed on the slide in conversation, but also to think of solutions that are feasible on your own after having conversations with your participant. And at this time, we would like to conclude this 4th module. Please follow the instructions to complete the module quiz and move on to your final module video. Thank you.